Welcome to This Is What Democracy Sounds Like. I'm Kevin Prang. This program is presented by Metropolitan Congregations United. MCU is a community organization that brings together religious congregations, community groups, and individuals to work for a common purpose to create a better life for all residents of the region. We are working towards building people's control of the government, building community control of the economy, expanding the public sphere, and creating structural racial equity. Today, our guests are Richard von Glahn, who is the Policy Director for Missouri Jobs with Justice, and Bob Karr, who coordinated MCU's congregations to gather signatures for Medicaid expansion. And today we're going to talk about Medicaid expansion in Missouri and also a couple of other issues that we're tracking. So welcome, Richard and Bob.
Good afternoon.
Thank you for having me.
So the signatures have been turned in. So let's just start with that. What were the results?
Sure. The Healthcare for Missouri campaign turned in nearly 350,000 signatures, over 2 times as many as are needed to qualify for the ballot. So we feel very confident that we will be voting on this fall. The next steps in the process are either the Secretary of State or local election authorities will validate those signatures, make sure we got enough from each congressional district that we had to qualify in, and then the governor potentially has a role in deciding if this will be on the August or November ballot, although I would say every citizen initiative petition ever done in nearly 100 years in Missouri has been on the November ballot. So it would take the governor pulling off some funny business to try to move it to August.
And here's a chance for both of you guys to do a little bragging. How many signatures did the individual organizations collect between Missouri Jobs with Justice and MCU?
Well, MCU collected over 15,000 signatures. We had over 150 volunteers who were involved from many different congregations.
And Jobs with Justice, which is a statewide organization, gathered about 40,000 signatures on our effort. And similar to MCU, we had hundreds of people all across the state involved in that effort. And I would say both MCU and Jobs with Justice are part of a coalition called the Missouri Organizing and Voter Engagement Collaborative. And collectively, we gathered about 105,000 signatures with some partner organizations that we work with. Excellent.
And did you hear about, how did the signature collecting go in some of the rural areas where these issues are not expected to gain traction? Has it been positive in those areas also?
I will say for Jobs with Justice, we found, particularly in a number of rural counties, that a lot of people are experiencing the closure of hospitals or the cutback of services that hospitals are needing to do because they have so many people that should be covered by Medicaid, but instead are uninsured, and they're having to provide uncompensated care. So some parts of the state that politically you might think would be more resistant to something like this were actually some of the most supportive voters that we found.
Okay, excellent. And Bob, can you give us an overview of what is the Medicaid expansion? Why is the voter initiative needed, and what's going to happen if this passes?
Well, this takes advantage of a provision in the Missouri Constitution that's been there for many, many years that allows voters, citizens, to bring forward proposals for consideration by the voters of the state. And so in the case of Medicaid expansion, the opportunity has been there for, I think, about 10 years for the legislature to expand Medicaid coverage. If that's in those states where that's happened, that's paid for 90% by the federal government and 10% by the state. That's not been approved by the Missouri legislature. So that led to the voter initiative petition to do this. And if this is successful, it'll bring healthcare coverage to over 200,000 Missouri residents who do not currently have healthcare coverage and who are also in poverty. The main areas that, or the main part of the populace that would benefit would be people between 19 and 64 who don't have disabilities.
And how have we seen, the outbreak of COVID-19 sort of forced this need for the Medicaid expansion in Missouri?
The threats posed by COVID-19 really are a great example about why people shouldn't have to choose between health and other priorities in their life, between their health care or paying their electric bill or paying their rent or anything else. One of the most important things that people can do around COVID-19 is to get tests if they are not feeling well. But if you don't have insurance, often things like preventative care or tests are things that can force you to make other difficult prioritization decisions. And so I think this is a great example about why people shouldn't be forced into making those decisions. I would also say that we've seen with COVID-19 a especially disproportionate impact on Black Missourians, and they're also disproportionately in the Medicaid gap. So we see a particular harm to a particular community that Medicaid expansion could really help benefit.
And I would just add to that certainly people with pre-existing conditions are more likely to suffer the consequences of COVID-19. And of course, that's particularly amplified in people who have pre-existing conditions and don't have health care. And so their health may not have been as good as it could have been even before they encountered the virus.
Richard, can you follow up and talk a little bit more about that Medicaid gap? What is that? Define that term for us.
Sure. So in the Affordable Care Act, if you make 100% of the federal poverty level, then you can get subsidies in the marketplace. That is how the Affordable Care Act was designed, so that at a certain point you begin to get federal government subsidies to buy insurance on the private marketplace. However, in the design of the Affordable Care Act, the idea was that anyone below 100% of poverty would be covered by Medicaid. And in the Supreme Court ruling on the Affordable Care Act, they actually struck down the requirement that states expand their Medicaid eligibility. So in Missouri, which has one of the lowest Medicaid eligibility programs in the country, first of all, if you do not have a child, you are not eligible for Medicaid, period. It doesn't matter if you make $5 in income in the year. You are not eligible for Medicaid. But if you're a single parent and you make, it's about $3,200 a year, not a month, a year, you are deemed too wealthy to qualify for Medicaid, and you are expected to purchase insurance on the private market. But again, that is, while you might be too wealthy to qualify for Medicaid, you are not wealthy enough to qualify for a subsidy for the marketplace under the Affordable Care Act. And so there are over 200,000 Missourians who are in that thing that we call the Medicaid gap. They're too wealthy to qualify for Medicaid because of our stingy eligibility requirements, but they do not make enough to access the federal supports as part of the Affordable Care Act to buy insurance on the marketplace. 36 other states, as well as the District of Columbia, Republican states, Democratic states, have recognized just how illogical and unfair that is, and have taken the steps necessary to close that gap by expanding Medicaid.
A lot of what I hear from people who are opposed to this when we were out collecting signatures is that it's going to raise taxes or it's going to hurt Missouri's budget. So what's the truth in those statements?
Well, the studies that have been published in states that have expanded Medicaid, including, as Richard said, states that have both Republican and Democratic legislatures, have shown very consistently overall healthcare cost savings associated with Medicaid expansion. And so I think that those arguments that you just cited are very narrow and aren't supported by the studies that have been done based on the experience of other states.
Who are some of the organizations that are helping with the support on this issue? It seems like it's been a pretty broad coalition.
So it absolutely is. There are groups like the Missouri Hospital Association, the Missouri Primary Care Association, a lot of healthcare providers that have firsthand experience with interacting with a population that is struggling due to not having Medicaid expanded. There are more advocacy groups that have been working on this for a long time, groups like Metropolitan Congregations United, Missouri Jobs with Justice, the Missouri Rural Crisis Center, others who see people in our communities who are suffering, who are doing this. You see the support because of the economic benefits to this. You see support from groups like the Chamber of Commerce as well as the Missouri AFL-CIO. You see groups like the Missouri Catholic Conference, the Missouri Missionary Baptist Conference, people of faith from lots of different and diverse faith backgrounds, all recognizing the value of human dignity and human life, who are stepping up to support this effort.
Okay, and now that you said that it's probably likely that the vote will be, or this measure will be on the ballot in November, and there's a possibility it could be in August. So what are sort of the next steps in the campaign once we find out which ballot it's going to be in, and what types of outreach are each organization, probably going to be ramping up? I know plans aren't firmed up at this point, but what can you imagine at this point?
Well, from the MCU perspective, what we're planning to do is re-engage with the volunteers that collected signatures and the congregations who were involved to further educate them about the importance of getting this passed, and then to do the canvassing to get people out to vote for this. I think part of that effort will be dispelling some of the misinformation about the cost implications along the way. So I think it's really education and mobilization of people as we move toward the election time.
And Richard, what about Missouri Jobs with Justice?
Yeah, I think Robert is right. I think the important thing is going to be letting people know that this is going to be on the ballot. While there's 350,000 people that have signed the petition, I think a lot of people are used to following the legislature for how laws get made. Missouri is very fortunate in that we have the ability to directly petition our neighbors to take action on things that the legislature has for far too long ignored. But it's making sure people are aware that this is going to be on the ballot and have the facts and information to be able to go and make an informed decision on it. And we think if we do that, we feel confident that it will pass.
Okay, and to follow up on that, in my understanding that the Missouri legislature has already been trying to sort of blunt the impact of this with a couple of policies they're trying to pass at the last minute in this session of the legislature.
Yeah, I think one example is the discussions about adding a work requirement to Medicaid coverage.
Yeah, and work requirements have, not fared well legally. They often get thrown out, but even if they're not, they're really, I think the better way to describe them is busy work requirements. It sort of creates a bureaucracy that isn't really about helping people. It's actually designed to try to throw people off state assistance at times that they need it. So there's been some discussion and effort in the Missouri legislature to maybe move forward with something like that, but that is a economically inefficient and legally questionable program. So we think the legislature would be better off in doing simply what the governor has said that he would do, is wait and see how the people vote on this and then implement that decision.
Okay, and Bob, can you talk a little bit about MCU's efforts to bring more congregations on board during the signature gathering process, and how did that go for you?
Well, it was a very interesting experience, and actually a very positive one. So we came at it from multiple angles. There were a number of our volunteers who self-identified, and we worked back into their congregations from that angle. But we also contacted a number of congregations where there were not volunteers. They often invited us to bring people there after services on Sunday and collect signatures. Another category I want to particularly comment on is the Catholic parishes, and of course, in that case, we had the benefit of the support of the Missouri bishops for Medicaid expansion, and eventually that led us to some very large parishes in St. Louis County and St. Charles County, where there was really an amazing response. Hundreds of signatures collected, and it was dependent on two things. One is the leadership came out clearly in favor, and secondly, the members in the various parishes really mobilized to do the work.
Really able to broaden our coalition through this effort then?
Well, yes, absolutely. Some of it depended on churches that were already involved with MCU, but in a number of cases, we made contacts and built bridges with churches that had not previously been involved.
Okay, excellent. I'm going to switch topics now. Let's talk about a couple of other things that have been in the news recently before the legislature, and specifically, let's talk about Clean Missouri. Things have been happening moment to moment, so I do want to let listeners know that this is as of Wednesday, May 13th at 3:20 in the afternoon. So, Richard, what have you heard?
Sure, and there's unfortunately probably not going to be as much news about this. Just on Monday, the chair of the Legislative Rules Committee, stated in a hearing that the Republican proposal to reinsert the ability of political parties to gerrymander back into the Missouri Constitution was filled with errors and needed correction. That was what he communicated, is what someone from the Republican Party had told them. Unfortunately, that did not stop the House of Representatives from passing Senate Joint Resolution 38 today without taking the time to either identify or correct any of those errors. They simply went through and spent several hours in the middle of a pandemic with over 500,000 Missourians having filed for unemployment. They spent several hours debating and ultimately passing really what can only be described as a politician protection plan. And this will be coming back to the ballot to Missouri voters. They cannot repeal Clean because that was a constitutional amendment, but they can ask for people to vote again. And so this looks like at this point that this will also either be on the August or November ballot. What the legislature passes goes onto the November ballot, but the governor could try to intervene and force it to an August ballot. But the legislature has really, I think, challenged the authority of over 1.4 million Missourians who voted to rid our state of gerrymandering less than 2 years ago, and have asked us to consider it again. But I feel confident that at least 1.4 million, if not even more, will be offended by this action of the legislature and will be voting no on what tentatively I believe will be Amendment 3, either on the August or November ballot.
Can you give a little bit more detail on what exactly the proposed changes are?
Sure. Their proposal is to give the two political parties, Republicans and Democrats, greater authority on placing members on a redistricting commission. So they specifically refer to it as a bipartisan commission, whereas in other states there have been efforts to have nonpartisan commissions, people not involved with political parties. What the Missouri legislature has proposed is a bipartisan commission, so specifically people who are involved with the political parties in charge of drawing the districts that people would run in. They are seeking to specifically authorize a level of gerrymandering that is a mathematical formula, but has actually not occurred in any state legislature to this degree since the late 1970s in Mississippi. But what the Republican proposal that just passed did specifically authorizes that level of gerrymandering. So it's really going against the spirit of Clean Missouri and what 1.4 million voters, indicated that they wanted here, and is going to go back on that. So that's what they're up to. There are other provisions of it that I think are very problematic, including provisions that potentially would not count immigrants or children in the drawing of districts, and move away from currently every state has a total population requirement. And there's discussion about making Missouri a test case to move away from that. That has long been both a Republican and, frankly, white supremacist goal, because that benefits older, whiter populations in the process. So there will be a lot more to discuss about that, but that's part of what's included in their proposal.
I find one of the interesting things about that proposal, and almost an easy comeback to that, is reducing the number of people that you count will reduce Missouri's representation in the U.S. House then, correct? Or is that do we get to use two different numbers?
Well, it's interesting. It's actually two different numbers. The U.S. congressional would continue to count children and immigrants because that is the federal standard that everyone abides by. But then you would have to ask yourself, why does one political party want to use a different standard for how we do our state legislature? And the answer to that is frankly, it is a manipulation of things. For every two white children in Missouri under the age of 18, I believe there's 3 black children and there's nearly 4 Latino children. And so while not counting children, I think, is offensive to everyone, it particularly has a negative impact on Black and Latino communities.
Okay. And then related both to Clean Missouri and Medicaid expansion, there was a proposal to change the rules regarding ballot initiatives in Missouri. Did that make it, or does it look like it's going to make it out of the session this year?
So that is currently included in at least 3 different the sort of large omnibus bills that the legislature is doing. I mean, there are bills that are now 75, 80, almost 90 pages long, dealing with lots of different issues. So there are a couple pieces of legislation, Senate Bill 552, Senate Bill 587, and I believe it's Senate Bill 785, are all pieces of legislation that would impose, for the first time, fees on Missourians that file initiative petitions. So if you wanted your neighbors to consider an issue, you would have to pay a $500, access fee to that tool of democracy. And there are other various provisions in there. It would also give the Attorney General and the Secretary of State broad new powers to interpret initiatives and potentially weigh in on whether or not issues should be allowed to move forward and go to voters. So the really problematic bills, I know Robert was part of a delegation that came up to Jefferson City earlier this year and spoke with senators about preserving the over 100-year history that Missouri has for the initiative petition process. And we hope to see those bills defeated and maintain access to democracy and direct democracy through the initiative process.
Okay, thank you for that information. That's really good detail.
Let me ask Richard to follow up. Richard, as those move forward, I guess we're down to the last two days or so. Is there likely that there'd be a filibuster to as a way to address those?
I mean, it is certainly possible. I think there are actually senators from both sides of the aisle and groups from both sides of the aisle who really value this tool of direct democracy. And as a lot of these bills are getting loaded up with multiple subjects and multiple provisions, it makes it a little hard to tell exactly where they are. But certainly that is our hope, that some of these bills might face a filibuster in the final hours.
So things are wrapping up pretty quickly at the State House in Jefferson City. We will come back and talk about some of these things again. Richard, just a final note from you. Any final words about Missouri Jobs with Justice, what you guys do, and any other efforts that you've got going on, maybe even during the summer and during the pandemic?
Sure. So Missouri Jobs with Justice is a coalition of labor, community, faith, and student groups, as well as individual activists that fight for really an economy and democracy that work for working people. That is our main focus. And so we will certainly be defending the mandate on Clean Missouri, it sounds like this summer and fall, as well as supporting the long-delayed expansion of Medicaid in Missouri. But one thing that we're also looking towards for the future is we think the pandemic has really exposed how antiquated and broken Missouri's voting laws are. 34 other states allow people to vote absentee or potentially vote early without needing an excuse. Missouri is not one of them. We have very limited provisions as to why you can vote early, and that has created a lot of confusion across the state as to how people vote safely in this time. And so we think it is certainly time that Missouri have a more updated and modern system of conducting elections. And so we're going to be working on putting together a campaign for that.
And Bob, any final thoughts from MCU's efforts on any of these issues?
Well, I think now that we know that we'll be working on two things at the same time, Medicaid expansion and the defense of clean, I think it actually creates a very interesting opportunity to build some more bridges among voters. Because even though on the surface these seem like disparate issues, they actually, I think, tie together very well in terms of things that people fundamentally believe in. So we look forward to further educating people and getting people out to vote.
Okay, I want to thank our guests today, Richard von Glahn, the Policy Director from Missouri Jobs with Justice, and Bob Karr, who coordinates MCU congregations to gather signatures for Medicaid expansion and then also be defending Clean Missouri. To learn more about MCU, go to the Metropolitan Congregations United website at mcustlouis.org. And Richard, give us some contact information for Missouri Jobs with Justice.
Yep, our website is www.mojwj.org. You can follow us on Twitter at MOJWJ or at MOJWJ or Facebook, Missouri Jobs with Justice.
And also follow us on Facebook and Twitter and Instagram for news and events. And if you want to participate, that's the place to find it. And we have plenty of opportunities for you to sign up and get involved on those social media outlets. I'm Kevin Prang, and you have been listening to This Is What Democracy Sounds Like. Tune in again next time, and thank you for listening.